My name is Cynthia Johnson, and I am a current student in HSML 4660, Intervention Strategies for Behavior and Chemical Addiction. It's a hybrid course taught at the University of North Texas, Dallas campus. In this video assignment, I will introduce you to a substance abuse treatment facility that provides both residential and outpatient programs for inmates. Gateway Foundation Corrections is housed at the Creusot Judicial Residential Treatment Center in Lancaster, Texas, although many say that it is located in Wilmer, Texas city limits. Gateway Foundation Corrections has been providing drug and alcohol treatment services throughout the United States since 1968. However, it just started providing treatment centers services in Texas in 1992 when Ann Richards was governor. Their programs are structured for the offender population, jailed offenders, probationers, prisoners, inmates, parolees. The Gateway Foundation is a national nonprofit organization whose mission states they are committed to reducing substance abuse and co-occurring mental health problems through effective and efficient treatment programs. As I stated earlier, Gateway does provide both residential and outpatient programs to inmates. These are inmates who have been taken into custody by the courts, but instead of going to jail, they have been ordered to receive treatment at the Wilmer facility. The Gateway Foundation Corrections, they offer in-custody residential treatment programs throughout the United States, but the one I'm focused on today is the one that's in the Wilmer, Texas location. So while I was doing research on their residential programs, I found out that Gateway uses a modified version of the therapeutic community treatment and intervention model. It's designed specifically for the prison residential groups. They use a participatory approach to treat the inmates' different needs, such as mental disorders, any personality disorders, along with the substance addiction that they're suffering from. Their assessments, their interventions, and treatments are tailored for the jail offenders. And because of their unique needs, the interventions are adapted based on the client's current conditions and their risk levels. The Gateway Foundation programs also include outpatient counseling, reentry transition programs, and structured day reporting as well. The client learns how, through post-release care, how to reentry back into the real world through relapse prevention and through reentry life skills. The outpatient services are available 6 days a week, both day and evening hours. I also had the opportunity to interview one of their staff, Miss Courtney Sims, and she told me a little bit more about the clinical positions that are at the Wilmer location. They have a nursing supervisor. They also have a program director. They also have a clinical director, 2 of them really, one for the male and one for the female clients. They have a clinical supervisor, and they have the LCDCs also. You know, I was excited about that. The LCDCs, I'll give you a little bit of background on what they do. They complete the comprehensive assessments. So I'm sure that's the biopsychosocial assessment on the client's substance abuse history and the treatment requirements, and they also develop individualized treatment plans. They also participate and facilitate group and individual counseling. They document treatment plans, and they document the client's progress and the responses during their treatment. They also perform case management as well. And I noticed that they only consider candidates that has their LCDC license with at least 2 years experience in substance abuse or mental health counseling. Must also be able to obtain background clearance from the Dallas County as well. They also have LVNs, direct care monitors as well. When I asked Ms. Stem about their intake process, she said they pick them up from the Dallas County Jail, and they see the nurse, and then they change into their uniforms. They fill out their paperwork. Then they are sent back for haircuts. I thought that was interesting. They also do an initial intake demographic profile, just, name, age, sex orientation, not sex orientation, but sex or gender, that type of thing. They also have to sign off on a client handbook and making sure that they understand the process and what's going on with their property as well. When I asked her about the assessment process, she said comprehensive assessments are given throughout the treatment episode to identify their specific needs and risks at different points throughout their stay. The standard instrument that they use is the Addiction Severity Index, and they also use other assessments that's specific to the criminal justice population. And she kept talking about the modified one that they use from TCU's Institute of Behavior Research. When asked about their case management services, I spoke to the clinical supervisor, Ms. Faber, and she provided an excellent rationale on why it is not really focused on at their facility. Ms. Faber stated that case management services are provided by the probation officer. So the counselors, the LCDC counselors, can focus on substance abuse treatment or counseling only. It creates a lot of problems with their probation and the stipulations if you allow inmates off campus for medical or any other businesses. Now, she did say that they do provide medical, dental, and psychiatric visits if it's really, 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 really necessary, but just on a generic, normal basis, she says, no, they do not. We have to remember that these clients, they are still in the custody of the court, so they have to be mindful of that. She also stated that the LCDCs sometimes forget that they are LCDCs. They want to stay in their social worker mode or that scope of responsibility, and this takes them away from the substance abuse counseling that they're supposed to be doing. So she said she's found herself having to bring them back and stem back into their LCDC clinical roles. Ms. Faber also shared with me an incident where when they did allow clients to go out for either a housing interview or to go see the doctor and come back, they'd be as high as a kite. So I can appreciate their restrictions and their structured environment. When asked about the list of fees, Gateway is funded through a contract with the Dallas County Judicial System, the Commissioner's Court, because the inmates are mandated by a judge to receive treatment. When I asked how long an individual receives services, mandatory 6 months. And the only reason they would do an early release is due to an unsuccessful discharge, which is based on if they break a rule or if there's any type of negative behavior issues that's going on. If that happens, then Dallas probations come and pick them up and take them right back to Little Sterrett. Early release can also happen if the inmate has a warrant in another county. That county does have the right to come pick them up if they want so. Also, if intensive medical needs are required, they cannot be managed by the facility or through a normal medical visit, then the inmate will be discharged due not to being able to complete the program, regardless of what it is. If they're not able to complete the program, they're just not able to. And also for psychiatric issues, they will be discharged with a psych discharge. When I look at the program and when I researched it, I found that I really like the program the way it's set up because they stay focused on substance abuse, regardless if it is alcohol or any other drug of choice. Because they collaborate with other county agencies and professionals, they are able to push those responsibilities to them and stay within their scope of practice, reducing substance abuse. Okay, this may be the reason why their recidivism rate is so low. In closing, I hope I have not only met the requirements for this assignment, I also hope that I have provided valuable information about this substance abuse programs when it comes to correctional treatment centers. If you have any questions, please do not hesitate to email me. Thank you. Take care.